Production funding for Another View comes from the Hampton Citizens Unity Commission, using the time, talents, and skills of a broad base of citizen volunteers to help break down racial and cultural barriers, working to achieve the City of Hampton's community plan for a healthy, diverse community. And from the African American Programming Advisory Group, community visionaries assisting WHRO to engage, enlighten, educate, and entertain all communities in Hampton Roads. And now, Another View.
Hello, everyone. I'm Barbara Ham-Lee, and welcome to Another View. You've seen the ribbons, you may have participated in the rallies and marches, and more than likely, someone you know has been affected by this disease. We're talking about breast cancer. Breast cancer is the most common cancer among African American women, and it's the second leading cause of cancer death for us, right behind lung cancer. But it doesn't have to be this way. With early detection and good medical care, you can be a survivor. Let me introduce you to Frida Bryan, a 7-year survivor, and Karen Parker-Chesson, a breast cancer awareness advocate and the daughter of a survivor. Welcome, ladies, to the show. Thank you so much for joining us.
Thank you.
Frida, 7 years. Since your first diagnosis with breast cancer. Can you talk to us about, one, how you found it, and two, what your journey was?
Well, it was 2002. I was 36 years old, so I was not old enough for a mammogram, did not have any family history. And most breast cancer patients don't have the family history. And I did my monthly self-breast exam and felt a lump about the size of a pea and knew that it was different. That it wasn't there the month before. I had learned to do self-breast exams in 1987 when I first joined the Navy and had been doing them, so I was able to detect the difference. And it was the early detection that I think helped save my life.
Do you remember how you felt when you found it? Were you scared? Were you nervous? Were you, what is this? I mean, do you remember what your attitude was?
At that time, it was, well, this wasn't there, and had really no idea that I would come back with the diagnosis of breast cancer. I really did not. Went to the doctor, they confirmed, yes, it's something different, let's get a biopsy. No risk factors. I did not smoke, didn't drink. I had just come off a 6-month deployment, so I was exercising a lot. And the doctor and myself and my caseworker, we were just all shocked at that time. And
so then they started talking with you about different treatment options?
Yes. All my treatment has been done at Portsmouth Naval Hospital. I went through 2 lumpectomies, did not get free margins, which all the cancer wasn't gone. Ended up having a mastectomy, lymph node involvement, so I had chemo, had radiation, had reconstruction. I can't complain. I'm a blessed individual. But went through all of that, was in remission for 5 years, was on the drug tamoxifen, was in remission for 5 years, actually celebrated my 5-year cancer-free, and had a low back ache, and the doctors looked at it, and that's always in the back of our mind as survivors. Has it come back? Is it come back? Where's it going to come back to? And in 2007 was re-diagnosed with bone metastasis.
And so now, did you have to go through chemo and everything once again?
No, not again. We changed the medicine. Actually, I went down to Duke for a second opinion. Dr. Blackwell, which is an outstanding doctor. We decided not to do chemo. I did 10 more treatments of radiation just for pain and to slow down the progression, and switched the medicines, and that has helped. It's slowed down, but I'm living with chronic cancer, bone cancer. And I view it as just like anyone who may have diabetes. I can't complain. As cancer survivors, we make a choice to not just exist, but we live, and we're living with it. 'Cause I was going to say,
I mean, looking at you, you look picture perfect healthy.
Well, thank you.
So,
thank you. Thank you. I have to tell you.
Do people have a misconception then that if you have breast cancer or you have this bone cancer that there's going to be something different about you, or you're going to be, you know, all broke down?
Well, you know, to be honest with you, I can tell you that I've gone through my days where I've cried and asked God, why me? And I'm a Christian, and God said, well, why not you? And this might not be for you, and be patient. Trust me. My pastor, Pastor Mariner, always talks about you should not look through the hell that you're going through. And I am really thankful for the experience. I call it my blessed journey that I had. And I was one of those people who saw the address labels and the pink ribbon. It's like, oh, that's the pink ribbon people, and I'll send in my donation. And that was my contribution until my own diagnosis. And I think I've learned to turn my mess and my instance into my passion and getting involved with different organizations like American Cancer Society and Sisters Network and Living Beyond Breast Cancer and the Live Strong organization, where I've learned not to just exist, but I'm thriving from it. Yes, ma'am.
Now, Karen, you're an advocate, and that started because your mother is a survivor, correct?
Absolutely. A few months shy of her 60th birthday, we discovered that she had breast cancer, and that was an absolute kick in the stomach. There was no family history of breast cancer.
Wow.
My mom started off with a mastectomy. Just a few months later, cancer in the other breast and another operation. So that's how I ultimately became an advocate, if you will. I always say that I'd never like to use that word because it seems so serious. I just knew, working as a radio personality at that time when she was diagnosed, I wanted to do something more than think pink, wear pink, or read a few lines of a PSA every October for Breast Cancer Awareness Month. So that's ultimately how I began.
So talk to me about your advocacy. What do you go to the doctor with someone who's been diagnosed, or do you just spread the word? What exactly do you do?
Well, initially, once my mom was diagnosed, I decided, well, there's got to be something that I can do. At first, I just didn't know what I was going to do, but through my mom's diagnosis and treatment, I learned about the disparities between the diagnosis of Caucasian women and African American women. African American women generally are not diagnosed into a much higher stage of breast cancer. They don't have the affordable health care options that are available to some other groups of women.
As a matter of fact, the studies are even saying now that there, in some states, the mortality rate for African American women with breast cancer is going up.
Absolutely.
Where everyone else, for other races, it's going down.
Yes.
And so that disparity, that not getting to the doctor on time, is a big issue.
Very big concern, and that's where I learned that's what I can do, because at the time I was a radio personality, and that audience that I spoke to every day that considered me their friend, their sister, their niece, or what have you, I could engage them. I had the perfect audience of women. We served a demographic of African American women aged 25 to 54, and I had that audience every day. And at first I was very nervous. I'm like, I'm not an advocate, I can't do this, you know, I'm just going to put something on the website. But I honestly felt that it would be very irresponsible of me to have this kind of audience and not do something.
What are some of the things that women, and I'm going to ask this to both of you, that women tell you when you're talking to them about, you know, do your breast exam, go get your mammogram? Do you get the, I'm not going there, or, you know, it'll be all right, you know, or whatever? What's the responses that you hear sometimes?
Well, what I've heard in the past is, well, I don't want it to come back as cancer. And a lot of women don't
so they're
look
afraid
past,
of what
yes,
it's,
of what it is
say.
going to be. So instead of thinking early detection, and a lot of people view as, well, if you get cancer, then you're going to have to go through chemo, I'm going to lose my hair, I'm going to be sick all the time, all the negative aspects. And it really is different for every person. And did I lose my hair? Yes. Has it grown back? Yes. Did I lose a breast? Yes, I did. But I also realized that my breast didn't define me as a woman. And I try to tell women, as I'm talking to different groups, is the early detection. We don't have a cure. We don't have a prevention for it yet. So if we catch it early, you can live. And like Karen had said, for African American women, we're dying at a higher rate, not because we're catching it more, but because we're catching it in the latter stages.
Later, before they can do anything. And the breast exam is the first step, the self-breast exam. And we want to talk about the proper way to do a breast exam. Lisa Godley and Dr. Khadijah Jordan show us in this report.
Dr. Jordan, what is the best way to perform a self-breast exam?
The most important thing is knowing your body. Just like looking in the mirror every day, you know when you get a new bump. So you have to examine your breast every month. Usually it's best to do it the week after your period, or when you would have had a period if you don't have periods anymore, and do it in an organized fashion. So you usually will examine your breast in a clockwise fashion using the pads of 2 or 3 fingers, and not just pointing down, but really palpating and feeling around, making sure that the breast moves, that it's not stuck to the chest wall underneath. Because really, the breast is just a lot of fat on top of our pec muscles like men have.
What exactly are you looking for?
You need to look at your breast in different positions. Standing, with your fists on your hips, with your hands behind your head, and also bending forward, looking in the mirror for any signs of like an orange peel look. That can be a sign of cancer. You also need to look for retraction. It's like a dent or pulling in the skin. That can be a sign of cancer. And we also need to look at the nipple and pull a little gently and make sure we don't see any blood or green discharge. After we finish that, we usually will examine underneath the arm, because actually the tail of the breast goes underneath the underarm, and you can have cancers come up there as well. Not only there, but you also should check under and over your collarbone and onto your neck to feel for any abnormal or different lumps. And that's basically it.
And that breast exam is so very critical, isn't it? Yes, every month, and as Dr. Jordan said, if you are menstruating, it should be right after your period, correct?
A few days after your cycle.
A few days after your cycle. And then if you're in menopause, you pick a date.
What I found to help a lot of ladies is their birth date.
Yes.
Their birth date,
okay.
every time of the every time of the month, the same day of the month.
The same day, and then that way they can find. There seems to me that there are so many options in terms of what you should do once you've been diagnosed. How do you wrap your mind? I mean, you're already nervous and upset because you've been diagnosed. So how do you walk through that maze and figure out what's the best treatment for me?
For me, I had a wonderful caseworker and the team that I had. And granted, I didn't talk to my oncologist, my radiation oncology, and my surgeon all in the same room, but I had that team concept, and we were working together, and we have the tumor board. Well, they had the tumor board. A lot goes into consideration if there's lymph node involvement, how old you are, if there's other things that are going on besides the cancer. And right now, there's so much good research and cutting edge treatment out there for anyone who has a diagnosis to, well, what is best for me? My age, what type of cancer is it? Is it highly aggressive?
Because there are different forms of breast cancer.
Oh, absolutely.
Correct?
Yes.
And they go through different stages, stages 1 through 4?
1 through 4.
Is that right?
Depending on the lymph node involvement, if it's spread to outside of the ducts in your breast, you can, for me, I was initially diagnosed at stage 2, but then at the end of it, end up being a stage 3, and then of course in 2007, now stage 4. So it really depends. It's a very complicated and smart disease because you can become resistant, or the cancer can become resistant to the medication. And like I said, there's so much research going on right now. Every day there's something new, and you have to actually be smarter than the disease and help your medical team. But I think if a person doesn't feel like they have the team behind them, there's the psychosocial aspects of it also that gets us through, besides just the petri dish and treating the disease, but treating the person and the other issues that come along with the diagnosis.
Now, Karen, as a daughter of a survivor, what types of things did you do to help your mother?
Well,
what should family members take into consideration?
To me, I think it was important for my mother, and of course, at that time, she probably would not have admitted it, but later I learned it was important that I was just there and that I was listening and that I was also getting the information that she was getting and making sure that she heard it correctly. We were all involved in her treatment and care, but to be supportive is the best thing you can do for a breast cancer patient, survivor, if you will, and always sort of offer some encouragement and be willing to share if they're open to different types of support systems, whether it be the sister network that we talked about. I know my mother was especially private. She really did not want people to know. She's from the old school. She feels like all that, has to be secret.
And that's also another part of this, is that, especially for older women who think, this is private, this is my disease, the world shouldn't know about this. It's kind of hard for them to get out there. One of the things that you did also was this calendar in 2008, and I think we have a shot of it, but it's called Survivors 2008, and there's Myra Obendorf and Dawn Hester, who are very prominent women in this area, who have come forward and told people about their fight with breast cancer also. But you've got beautiful stories in here.
Thank you.
Of African American women, women of all races, but a lot of African American women. Was that important to you?
That was very important to me. I definitely wanted to show different women, different lifestyles, people from who had different journeys who became breast cancer survivors. Mayor Myra and Councilwoman Hester were great examples of, you know, women who were going steadily along their career path, and boom, here comes breast cancer. But they are definitely strong survivors. They are definitely warriors, and they were so open and willing to say, yes, this is how I've made it. And their stories are always stories, especially Mayor Myra. She is always willing to pick up the phone and call anyone. If she hears that you have breast cancer, she can offer some encouragement. She'll pick up the phone. Councilwoman Hester, she will. She's the same way. They were never shy about their advocacy or the way that they wanted to give their story.
We only have a few minutes left. The men can also get breast cancer, correct?
Yes, 1% of breast cancer patients are men, and we actually have a few men in the area that are open about it. Imagine how we feel and think it's secret, how a man would feel, and actually one of the more prominent survivors is Richard Roundtree. I had the opportunity to meet him last year when he was here for a play, and he said that when he became public with it, so many people came up to him, especially women, and said, "You saved my husband's life."
That's right.
You saved my husband's life.
Because he stepped forward.
Yes.
So it made them step forward.
Yes.
What would you look for what should you look for from your spouse, your significant other, in terms of support? I know a lot of women become concerned because they have to have reconstruction or they have to lose a breast, and like you were saying, it didn't define you. But for a lot of women, that's what they think makes them a woman. So
I think I can only speak for, you know, in my mother's case, she really did not say that she was too concerned about how she looked physically without her breasts. My father was very accepting. He obviously knew that breasts are not important to the makeup of a person, and that is very comforting because, again, my mother is from that old school mentality that everything is private, you know, everything is covered up, so you really wouldn't necessarily know she even had breast cancer. But I think the calendar and the advocacy that, you know, I've been able to be a part of in Hampton Roads has also shown a different side of her. She's been excited and been fulfilled by some of the things that she's seen me do, and now she talks, and now she is talking to other women, which is really wonderful.
That's fantastic. So if you had a piece of advice in the last minute or so that we've got left, a piece of advice to give to women and men who may be facing breast cancer or who need to step it up in terms of doing those self-exams, what would you tell them?
I would say early detection is going to save your life, and if you do have the diagnosis of just not breast cancer but any kind of cancer, you can get through it. This too shall pass, and learn to not just exist but live your life. Because really, we're just a blink of an eye away from anything.
Okay, and Karen?
I would certainly say be supportive of whoever the person is that is going through breast cancer. Offer them as much support as you possibly can. And certainly, I agree with the monthly breast self-examination. If you're 40 and over, you certainly want to have an annual mammogram. And if you have a family history, you definitely want to be more cognizant and probably a lot more diligent about making sure that you're on top of your breast care health. Okay.
And there's a website, Sisters?
Sisters Network.
Sisters Network.
Or Sisters Network Inc. Sisters Network Inc.org, cancer.org for the American Cancer Society, the livestrong.org. Basically, if anybody has access to the internet, Google cancer support or breast cancer. There are support groups just specifically for breast cancer. Even in the local area, there are breast cancer specific support groups or in cancer in general. But one of the biggest things is the support network that is built around the patient, whether it be the physicians or even the distant family members or the village. It took a village to get me through that with my neighbors.
And so you do need to speak up. You do need to let people know and you do need to let them support you as you go through.
Absolutely, absolutely.
Ladies, thank you so much for joining us.
Thank
You've had tons of
you.
information, and I'm hoping that everybody will pay attention and really get out there and get tested. And best of luck to both of you.
Thank
We really
you.
appreciate that.
having me.
And our thanks to Frida Bryan and Karen Parker Chesson for this enlightening discussion. Please do your monthly breast exam and get that mammogram too. And when we come back, we're going grocery shopping with a mother of 2 and a wallet full of coupons. Wait until you see the outcome. But first, here's what's happening in Hampton Roads. Welcome back. Times are tight, and one way to save money is clipping coupons for the grocery store. But it takes time and energy and discipline, and most of us think it's just not worth it. After you see this story, you just might change your mind. Meet Marcy Brown, a wife, a mother, and a coupon shopper like you wouldn't believe.
Marcy Taylor Brown is an avid coupon clipper. She sets aside one afternoon each week to cut them out and file them away.
Religiously every Sunday after church. That's my Sunday afternoon thing to do.
But is the time spent clipping and filing worth the money she saves? After all, many people like me clip coupons, and many people like me forget to bring them along. And when we do remember, there's always that 50-50 chance they've expired. So again, I ask, is it really worth it?
I'd say in a year's time, maybe 50 to 70% off my groceries. The last time I went to a store that had triple coupons, and I got $42.01 worth of groceries for $12.52.
Marcy's advice to coupon forgetters is to keep a coupon caddy and carry it just like you do your wallet. That way, when you find yourself at the grocery store, you'll have it. She also advises that once a month, go through your coupon caddy and toss the expired ones. To maximize her savings, she combs through the sales papers looking for specials, because using a coupon with an item that's already on sale is a bonus. Marcy also keeps grocery store savings cards on her keychain, so they're handy. Another money saver, rain checks.
I love them. Sometimes I purposely shop on the last day of the sale, knowing that they may be out of something that I want just to get the rain check. So I use those. I keep them in the back. I have some here. In the back of my coupon thing, there are some rain checks.
We decided to put the mother of 2 and her shopping techniques to the test. Marcy chose Farm Fresh as her store of choice because she could double her coupons up to 99 cents. Once we arrive, we decide our plan of action.
Get $50 worth of groceries for about $30, $35.
Okay, that's our goal. We're going to spend $30, $35 and get about $50 worth of groceries.
Yep.
Okay.
All right.
Let's go for it. By honing in on sale items and applying double coupons, we were able to get 2 items for less than 20 cents right off the bat.
Any canned fruit from Dole, 55% off, and again, we're in Farm Fresh where you get it doubled. So these are 10 for $10, so that's $1 a piece. $2, and then 55 cents doubled is going to be $1.10. I'm getting 2 cans of fruit for 90 cents.
Wow. Now they're four
for $5.
For $5, okay.
So I'd have to buy 2, which would have been $2.50, $1.25 twice. But my coupon is going to get doubled from 75 cents to $1.50. So $2.50 minus $1.50 is $1, and I'm getting 2 packs of product. Wow.
Since Marcy had 2 pasta coupons, she was able to get $5 worth of pasta for $2. Her total savings, $3. Marcy was able to find bargain after bargain after bargain, including a store special which netted her a carton of free eggs by buying 2 cartons of orange juice that was already on sale.
I think it was a dozen of large, and that's $1.38 I'm not going to have to pay because I got it free with the orange juice.
This coupon guru even had coupons which allowed her to get something for nothing.
Cilantro shrimp. That coupon said a free entree up to $4.09. Here's one 2 for $7, so it's going to be $3.50. I'm getting it totally free.
Wow. We'd only been shopping about 35 minutes when Mossy decided to call it quits. She'd gotten just about everything she was looking for and pretty certain she'd reached our goal of $50 worth of groceries for $30 to $35. In the end, we were able to purchase $50.76 worth of groceries for not $30 or $35, but for $19.22, a savings of $31.54. Now that's a savings. I wonder if I can get Mossy to shop with me on a weekly basis. For Another View, I'm Lisa Godley.
No, I want her to shop with me. That's it for this edition of Another View. If you like the show, please sign up for our eView newsletter. It's a once-a-week reminder of what's coming up on future programs. Please visit our website to subscribe, or you can write us at 5200 Hampton Boulevard, Norfolk, and send us your comments. We love hearing from you. Next week, the relevance of historically black colleges and universities in these tough economic times. We'll see you next week for Another View. Good night.
Production funding for Another View comes from Hampton's 400th Anniversary Committee and the Hampton Neighborhood Commission, partnering with neighborhoods throughout the city, working hand in hand to create vibrant places we are proud to call home and celebrate. And from the African American Programming Advisory Group, community visionaries assisting WHRO to engage, enlighten, educate, and entertain all communities in Hampton Roads.